Hello, everyone. Welcome to our third and final round of parallel sessions of the ANH Academy 2022. And this session is on food system governance, policy and legislation, chaired by Namakulo Kovic. My name is Emily Fifian and I am the technical manager for this session. So thank you all for taking part in ANH 22, and we look forward to a robust and interactive session to end the parallels today. Just a quick reminder that everything you might need to access the conference materials can be found on the ANH Academy website at anh.org/ANH2022. And now I will hand it over to Namakulo. Thank you.
Thank you very much, Emily. Yes, and welcome to everybody who has joined us for this session. As you've already been told, our session is on food systems governance, policy and legislation. And our first speaker is going to be Ms. Catarina Vasconcelos of City University of London. She's a Master of Students. She will speak to us on exploring the challenges and drivers of applying food systems approach specifically on how municipalities can address this concept in practice. Over to you, Catarina.
Okay, thank you, Namako. Hello, everyone. Today I'm sharing the results of a study that was undertaken as part of master's degree. And I would like to take the opportunity to thank my supervisor, Professor Karina Hawks. So to guide you through this quick and very informative presentation, I will do a topic contextualization. I will present the three main steps which illustrate the approach and findings I obtained, to then conclude with some policy implications. First of all, I would like you to think, how do cities actually need a food systems approach? Most of the big challenges we are facing nowadays are complex and recognize different activities, actors, interactions. So analyzing the interventions and policies through the lens of all the elements that compose the food systems is necessary to develop integrated solutions and coherent policies. So the aims of this study was to explore what are the challenges and drivers cities face in implementing food systems approach, while it tries to understand at the same time to what extent do Portuguese cities actually apply food systems approach to their strategies. Municipalities present an interesting governance levels with tools that can tackle food systems problems. So Portugal recently have several laws that were published giving Portuguese municipalities the competence to extend their intervention in food. And 5 Portuguese municipalities were used as study case for this study. So in order to assess how the Portuguese municipalities apply the food systems approach to developing food policy, this study took the 3 main steps. The first was to design an evaluation framework from a systemized literature review of both peer review and graded literature. Was undertaken to identify the different components that should be included in this framework. So this framework structure is composed by 5 criteria, namely food systems data monitoring. City governments should ensure that there is sufficient knowledge and data about the different components of their local food systems. Multiple outcomes, tools such as integrated food policy plans, which include food in several policy areas, public food procurement or capacity building are examples of measures that can potentially address multiple outcomes. Multi-stakeholder collaborations, the involvement and engagement of all stakeholders which are related to the food systems. And finally, food systems approach will support an integrated food policy that is characterized by the alignment of both horizontal and vertical integration. So after designing the evaluation framework, we skip to the second step, the main goal were to apply this framework to city food activities and strategies to assess to which extent they were following a food systems approach. Information about cities' activity strategies were collected through semi-structured interviews with civil servants or stakeholders from each municipalities. And as you imagine, it's difficult to say all the details and difference about how cities performs for each criteria, but I kind of highlight, for example, that food systems data monitoring and horizontal integration were the lowest ranked criteria, regarding food systems data, most of the projects and programs developed by the municipalities do not present a consistent and systemized evaluation mechanism of the indicators assessed by the municipalities are generally specific to each project or have no comprehensive assessment of their local food systems. The municipality of Porto stands out for presenting specific programs to assess the food environment, map food flows, or evaluate children's nutritional status at public schools. Another one about horizontal integration. In general, focusing on organic structure of each municipality, there were no teams or committees responsible for integration and articulation of food systems initiatives. Only Mertla as a constituted team that manage all food-related issues in their territory that work similar as Food Policy Council. So the best ranked municipalities stood out for having formal integrated food strategies that formally address, and they were formally address food systems outcomes, and there were Torres Vedras and Mertla. Finally, cities' interpretations about the challenge and drivers of applying food systems approach were also assessed by interviews. Regarding the challenges, municipalities identified funding frameworks as a barrier to frame their vision and integrated strategies. An interesting topic that also came out was related to collaborative governance skills, which cities identify as an important skill to maintain multi-stakeholder collaboration, and it was an handicap. In line with what was analyzed in the evaluation framework results, food systems data and horizontal integration were also topics that cities are aware of and identified as challenge. Nonetheless, municipalities have also identified drivers that enhance the implementation of food systems approach, and there are collaborations and partnerships. The importance of collaboration was one of the team's most frequently mentioned as an essential factor in applying food systems approach. The importance of getting to know good practice, promoting knowledge sharing through benchmarks, whether it is from engaging in specific city networks. For example, they mentioned Urbact or Milan Urban Pact, or by promoting study trips and participating in a conference where other cities share their strategies. And finally, political will was a topic municipalities identify as a determinant for bringing food to cities' agenda and consequently promoting integrated food strategy. To conclude, the finding of this study highlight the need to build food systems data mechanisms. The finding demonstrates how poor the city's mechanisms for collection, evaluation, and systemization of food systems data are. Generally, it is necessary to promote innovative methodologies and structures that enable data integrations from different disciplines and multi-stakeholders. Enhance multi-stakeholder collaboration between different food systems actors and stakeholders will help bring more perspectives and solutions to the table.
One more moment, 1 minute left. Thank you.
Perfect. So this will facilitate a more holistic view of the existing challenges. And finally, enable multi-level governance facilities to fully apply a food systems approach. Food policy integration is needed both downstream and upstream. And that brings me to the end. So thank you very much for your time and attention.
And thank you very much, Katarina. It's really nice to see work being done at that local level because it's very important. That's where the rubber, I guess, meets the road. Those who have questions, I ask that you put your questions in the chat. There is somebody monitoring the chat. And then when we get to the end in Q&A, we'll field as many of the questions as possible. Let's have Gabriela. Our next speaker is Gabriela Maria Freitas Centurion from the Friedman School of Nutrition Sciences and Policy at Tufts University. And her presentation is going to be on changes in children's and adolescents' dietary intake at school after implementation of Chile's law on food labeling and advertising in a longitudinal study. Gabriela, over to you.
Thank you so much, Namukolo. Welcome and thank you for being here for my talk, which is titled Changes in Children's and Adolescents' Dietary Intake at School After Implementation of Chile's Law of Food Labeling and Advertising, a longitudinal study. Thinking about the food system, there are different components of this system that can affect children's and adolescents' diets. One key aspect is the food environment, including the home and school environments, retail and commercial markets, restaurants, and others. Policies to modify different aspects of the food environment have been proposed in several countries globally, especially in the Latin American region, where Chile is an interesting case to study. So why Chile? Chile was the first country in the region and in the world that introduced mandatory front of package warning labels on packaged food and beverages that exceed cutoffs for calories, total added sugars, saturated fats, and sodium. As you can see from the map here, several other countries in the Latin American region followed with similar regulations, considering Chile as a model. So briefly, Chile's food labeling and advertising law was enacted in 2012, but it took another 4 additional years for the regulation to be finally implemented. As you can see here in the slides, the policy was rolled out in 3 annual phases, starting in 2016 and going from being more flexible to more stringent in terms of cutoffs for defining regulated food and beverages. The law is a comprehensive one because it doesn't only include the front of package warning label regulations, but also includes restrictions on child-directed food marketing and school regulations. Evaluations regarding the policy have shown positive results so far, both at the supply and at the consumer level, and include a decrease in the content of sugars and sodium in packaged foods and beverages, a decrease in household nutrient of concern purchases, as well as a decrease in soda purchases at the household level. There are other studies that also documented a decrease in children's and adolescents' exposure to high-in advertising. And there's also one study that documented a reduced availability of foods with front of package warning labels inside schools. However, it is unknown if these changes in the school food environment impacted children's and adolescents' diets. So the objective of this study was to assess the impact of Chile's law of food labeling and advertising on children's and adolescents' diets at school and out of school settings by measuring children's and adolescents' consumption of key nutrients of concern, total sugars, saturated fats, and sodium, those nutrients that were under the scope of the regulation, both at school and out of school settings, before and after policy implementation, using 24-hour dietary recalls. This study used longitudinal data from 349 children and 294 adolescents from the Food Environment Chilean cohort and the Growth Obesity cohort study, respectively. Participants in each cohort were on average the same age at the beginning of the study. Data were from 24-hour dietary recalls that were collected in the first semester of 2016, that was before the first phase of the regulation was implemented, and then in subsequent annual waves in 2017, 2018, and 2019, all post-regulation. We used the USDA food composition database to derive nutrient values. And it's important to point out here that this database does not include reformulation of packaged products, but still allowed us to infer the behavioral components of changes in intake. In terms of eating location, based on previous research, we classified eating location in 3 categories: home, school, and other locations. And other locations including restaurants, cinema, street, family or friend's home, and others. We also had access to anthropometric and sociodemographic data of children and adolescents in these 2 cohorts, which were used as controls in our regression models. For the analysis, the primary outcomes were changes in the mean percent of energy of each key nutrient of concern from total energy consumption at school. And secondary outcomes were changes in consumption at home and at other locations. Because participants from both cohorts are growing over time, we used a percent of energy outcome since it allows for total calories to increase as energy requirements increase over time. We use fixed effects models to compare nutrient consumption in each year to consumption at baseline in 2016 by eating location. Our models included clustering for repeated measures at the individual level and were adjusted for maternal education level, child and adolescent BMI score at baseline, consumption at locations different from outcome, and weekday. So now let's look at the results. Briefly, I would like to mention some of the demographic characteristics of each of the cohorts. For the children cohort, children were on average 4.7 years at baseline. About 50% were girls, and about 21% of the daily energy that these children obtained at baseline were from foods consumed at school. In the case of adolescents, they were on average 13.6 years, about 43% were girls, and about 26% of the daily energy came from foods consumed at school. So what happened with the consumption of these nutrients of concern? Regarding changes in children's consumption of key nutrients of concern, we found that children's consumption of total sugars, saturated fats, and sodium significantly decreased after policy implementation in 2018 and 2019 for sugars, and in 2019 for saturated fats and sodium. At home, we saw a decrease in total sugars, but no significant changes in saturated fats and sodium. Interestingly, while we observe a decline in the consumption of most nutrients of concern at home and at school, the opposite happened at other locations. So we found an increase in the consumption of these nutrients of concern at other locations. These results suggest that although it seems the school provides children and adolescents with a healthier food environment, there appears to be partial compensation of these key nutrients of concern at other locations. With adolescents, we found that consumption of total sugars and saturated fats at school significantly decreased after policy implementation, and no significant changes in sodium consumption. At home, with adolescents, we found no significant changes. And at other locations similar to children, we've observed a significant increase in adolescents' consumption of sugars, saturated fats, and sodium. So in conclusion, children's and adolescents' percentage of calories consumed at school from total sugars, saturated fats, and sodium declined after initial implementation of Chile's law. We found evidence of partial compensatory behavior with an increase in the percent of calories from nutrients of concern consumed at other locations. And it's important to consider that to influence overall consumption of key nutrients of concern, our results highlight the importance of considering different food environments with which children and adolescents interact during the day, and not only single settings. That's all, and thank you for your attention, and I look forward to your questions.
Thank you very much, Gabriela, for really an interesting presentation. I've always wanted to hear about what has happened with the Chile implementation. I move on to the next presenter, who will be Ms. Priyanka Jayawadema from Institute of Policy Studies of Sri Lanka, and she'll talk to us about assessing effectiveness of tax and traffic light signal system for coding in terms of regulation of sugar-sweetened beverages in improving healthy food choices. Over to you, Priyanka.
Thank you. I'm going to present the study findings on assessing effectiveness of traffic light labeling on SSB choices in Sri Lanka. We know that symbolic colors are very important to educate the public when making the food choices. In line with the global practices, Sri Lanka has introduced traffic light labeling for SSBs in 2016. According to this SSB regulation, traffic light labeling is applicable for 4 types of beverages. Those are carbonated beverages, fruit nectar, fruit juices, and ready-to-serve beverages, other than the milk-based products. So although this traffic light labeling has been introduced, adopted for more than 5 years, it has been not formally evaluated in Sri Lanka. So it is important to assess the compliance, effectiveness, and public understanding for successful implementation of this SSB regulation. To fill this gap, our study aims to identify, assess the effectiveness of traffic light labeling on reducing unhealthy SSB choices. In this study, we applied discrete choice experiment method, and this is widely used in applied and health research. There are 3 main steps in this study. First, we identify the relevant dimensions and the respective levels when making SSB choices. Then we applied the experimental design to identify the different combination of choices for our survey. Then, as a third step, we carry out the data collection and finally the econometric analysis. Take into consider that beverage characteristics as well as the SSB regulation, we found 3 attributes. Those are beverage category, traffic light labeling code, and price. Under beverage category, we considered carbonated beverages, fruit nectar, fruit juices, and also we considered milk-based products. Under traffic light labeling, we considered 3 standard colors, and also we considered no labeling category to capture the milk-based products. As I mentioned earlier, traffic light labeling is not applicable for sweetened milk-based products. Under price, we considered 4 different levels for each beverage type. And also we considered small and big pack when considering the prices. And with these 3 attributes, each with 4 different levels, we have 48 SSB choices. And for this study, we arranged these SSB choices in two SSB choices in 1 choice panel. There are around 1,000 possible pairs. So using experimental design, we used this data de-efficient design, and we generated 50 pairs for this study. And we arranged these 50 pairs in 5 blocks, giving that 10 choice per each block. Here you can see that the 1 sample choice card, it gives 2 SSB options under option A and option B with different attribute levels. So each respondent, in this survey, we offered 10 different choice panels. And we carry out this survey in markets and mini markets. And we covered all 9 provinces, and the sample size is around 2,500 customers. Out of these 5 blocks, we randomly assigned a block to each respondent and assign all the choice cards. As I mentioned earlier, there are 10 choices in each block for that respondent. And to analyze the data, we use mixed logic model. Our dependent variable is choosing SSB, whether selecting or not the given SSB choice. And the explanatory variables are traffic light labeling, categorical variable, we considered no labeling as the base level, and the beverage type, again, we considered carbonated beverage as the base level, and price. Now I'll move on to the findings of this study. The study reveals only 66% of the people are aware of this traffic light labeling system. And also consumer awareness differ by the population groups. You can see that more affluent and educated people are more aware of this traffic light labeling system. Also, when compared to females, the knowledge of this traffic light labeling less among males. And also when compared to youth and middle-aged people, that the awareness is less among elderly people. And also we inquired about the source of getting this traffic light labeling information. We found that more than 70% have got this information through self-observation. Interestingly, we found that the information received through any electronic or printed media is very less. Now I'll move on to the empirical findings of this study. We can clearly see that the people who are aware of this traffic light labeling system use their knowledge when making SSB choice, and they more likely to go for that healthier choices, that is with green traffic light labeling code, and very less likely to go for the SSBs with red traffic light labeling code. When selecting beverage types, we can see when compared to carbonated beverages, people more likely to go for that sweetened milk-based products. And also that prices negatively affect on that making a choice. To summarize these key findings, this graphical presentation clearly shows
just to let you know, you have 1 minute left.
Okay. Awareness of this traffic light labeling system is clearly associated with making healthy food choices. Here you can see that those who are aware of this traffic light labeling choose healthier SSBs and less likely to go for unhealthy SSBs. The probability of choosing a healthy product and avoiding an unhealthy one is greatest when traffic light labeling appears on the pack. Here again you can see that our considered base category is no labeling category. Options that people go for that green or amber is very less likely to go for that red option. And also, as I mentioned earlier, SSB choices are also significantly negatively affected by price. Finally, to conclude, the information on the sugar content of beverages using traffic light labeling help consumers to make informed choices. Consumers can use label as a shopping aid if they are familiar with them. Also, our study found that affordable prices can promote healthy SSB choices. And it is also need attention that awareness of traffic light labeling is not uniform across population groups. So better awareness can improve food choices.
Thank you very much, Priyanka. Really interesting study. I think we are ready for Medina now. I will introduce her again. Medina Juma Wendela is from Tanzania Food and Nutrition Center, and she'll share lessons learned from the implementation of Tanzania's first National Multi-Sectoral Nutrition Action Plan. And before you even start, Medina, thank you very much for the patience. Over to you.
Thank you, Namukolo. I'm going to present on the lessons learned on the implementation of Tanzania's first National Multi-Sectoral Nutrition Action Plan. This plan ended in June 2021, and the government of Tanzania did not conduct a formal end-line evaluation due to budgetary constraints. And the decision was made after reflecting on the midterm review and the end line of the implementation plan, as well as the existence of the current Tanzania National Nutrition Survey of 2018, which provides a benchmark on the quantitative progress of MNAP1 implementation. So both documents highlight the successes as well as the challenges that are highlighted in the key nutrition interventions of MNAP1 key result areas. So the study design based on, so this is a qualitative study design, and data were gathered on the overall effectiveness of MNAP1 and on the key result area objectives to check if the objectives of key result areas were achieved, and factors for successes, challenges, and opportunities for improvement or to carry over to MNAP2. Also, perceptions and experiences of MNAP1 implementation were collected through the technical working group meetings that were concurrently during the MNAP2 development, and through the use of the 7 key result areas, we used structured questionnaire, which had around 6 questions to guide the discussions among nutrition stakeholders. And we had around 8 to 12 participants in each focus group. So discussion based on stakeholders' own experience, as well as capturing their thoughts on the implementation and experiences of EMNAP1, as opposed to quantitative data sources. So they were asked in each question to come up with 3 main strong points that were representing the stakeholders' collective point of view. So the sessions were recorded for replay as well as for data quality during analysis. And then the responses were entered into a matrix that was broken down by question to differentiate a finding, whether it was to go as a carryover to EMNAP2 or taken as a lesson learned. And thereafter, we had a validation session with each KRA for 1 hour. And we had a 10 minutes discussion for each question to go through the responses. So the findings showed that majority of KRA members reported successful implementation of the plan, as well as it was helpful during the implementation period. There was also mixed perceptions of effectiveness vis-a-vis KRA's objectives. Some said it was effective, but yet some of the objectives were not met. So it was a mixed perceptions. And also some TWGs felt their responsibilities were not well featured and making it difficult to point to specific progress, like for DRNCD and micronutrients. Also, we had some few or no implementing stakeholders to some of the key results areas, like for DRNCD. And also government commitment was among the issue that was mentioned by all key result area as a significant enabling factor. And allocation of funds was also one of the enabling factor that was mentioned by all KRAs. And also appreciation of the Prime Minister's Office coordination of nutrition activities in the country, as well as donor commitment as one of the enabling factor. Challenges, there was inadequate financial resource that was mentioned across all KRAs, inadequate capacity among implementers, especially at the ground level. And then some of the targets and indicators selected were too ambitious to some of the KRAs. And then inadequate stipulation of stakeholders' roles and responsibilities. For example, private sector roles and responsibilities were not well stipulated in EMNAP1. Recommendation to continue with Prime Minister's Office coordination of nutrition activities in the country, and also to integrate nutrition programming into existing government program for sustainability, and then to select achievable indicators, because some of the KRAs were not able to, the targets were reached by a specific KRA, and also to continue regular forums, like we have the annual joint multi-sectoral nutrition review that convenes all stakeholders in the country, and they share experience and progress of a particular year for particular activities that are found in that action plan. And also to develop a local resource mobilization strategy, which is here you can see, it is going with the EMNAP2. So generally, there was a positive attitude among all 7 key results implementation, but also there was a mixed perceptions of effectiveness. And then the PMO coordination, Prime Minister's Office coordination, was a key component that strengthened multi-sectoral collaboration to improve nutrition. So it should be maintained that way. And also there's a need of having a resource mobilization strategy to complement the governance financing in the implementation of EMNAP2. Thank you.
Thank you very much. So before we proceed, I just want to remind you that you can put questions in the chat box. We will field questions after the next speaker. So our next speaker is Dr. Bagya Chengat
Oh, okay.
Prakash Babu from Royal Veterinary College in the UK, and he will present on value chain approach to combat stunting in low and middle income countries. Over to you, Dr. Bagaya. And sorry, I called you a he.
No, that's okay. Okay. Hello, everyone. Thank you so much for the opportunity. My name is Bhagya Chengat, and I am a postdoctoral researcher at the Royal Veterinary College. And I'll be talking to you about a work we did on value chain approach for stunting in LMICs. I'll briefly introduce the hub that I'm part of. It's called Action Against Stunting Hub. We are an interdisciplinary team of researchers trying to understand and reduce stunting. So we intend to take a whole child approach for a research in stunting, so that we don't just come up with a single focused solution that may or may not yield results, but instead our aim is to transform the research and potential interventions for stunting to be more holistic. So we work across different topics ranging from epigenetics to market-based interventions. And the hub has several work streams, and the work I'm going to present is part of the food systems work stream, where we aim to develop tailored market-based interventions to increase the availability of safe animal source foods. And the project sites for the are based in India, Indonesia, and Senegal. Just to give you a brief idea about stunting, according to WHO, children are defined as stunted if their height for age is no more than 2 standard deviations below the WHO standards. And it is estimated that nearly 162 million children are stunted in the world. And as you can see from the graph, most of them are present in Asia and Africa. Broadly speaking, three main causes of stunting are nutrition, genetic, and environmental factors. And within nutrition, obviously, something that everybody knows about is malnutrition, but food safety has a key role, because it is estimated that children who suffer from foodborne illnesses while they are young have a higher chance of being stunted. And the global nutrition targets aims to reduce stunting by 40%, but there are already been studies conducted saying that we are far behind that target. The current approaches to stunting are mainly to increase the uptake of a specific food commodity. And this is often done through agriculture development or introducing improved varieties of crops or through increased mechanization. But it has been said that the nutrition-only based intervention can reduce stunting only by 20%, even with 90% global coverage. So increasing a quantity is not just enough. We need to make sure that we are providing safe food and not just higher quantity of food. So why value chain approach and why animal source foods? Because animal source foods are important source of essential nutrients, and they are easily bioavailable. It has been proven through different studies that increase in uptake of animal source foods can reduce stunting. And why value chain approach? Through value chain approach, we can focus on economic, nutrition value, food safety, and sustainability. In this figure, you can see the three main factors that affect, related to food sources that affect stunting are safety, affordability, and availability of food. And if you look at the factors, if you look at this from a value chain approach, you can study multiple factors that lead to or that can alter the safety, affordability, and availability of food systems. And this is not a brand new approach. In fact, this has already been used in veterinary public health, especially when they try to address food safety issues. So a value chain approach allows us to characterize the entire food system, and it allows us to identify the intervention points at which we can increase the safety, we can make food more affordable, and we can also increase the availability of the foods that are being made available. Moving to our methods, we started off with a review and analysis of the data on animal source foods consumed within each country site. And then we mapped an initial structure of the value chain. Then we conducted focus group discussions and key informant interviews with different value chain stakeholders, starting from producers, consumers, middlemen, retailers, and transporters. We are also planning to conduct biological sampling at different stages within the value chain to isolate and identify key foodborne pathogens such as E. coli, Salmonella, and Campylobacter and Shigella. And the risk assessments will also be conducted on what is the risk of a certain foodborne illnesses because of ingestion of a particular type of food that has been contaminated with these bacteria. Now I'm going to present some initial insights from India. That's where we have been progressing a lot more in terms of data collection and fieldwork. So in India, we decided to focus on milk and eggs, and it shows that the complexity of the value chain depends on a specific animal source food. For example, in India, the poultry production system is vertically integrated. So there isn't a lot of option for informal vendors, whereas the dairy production system has a lot more informal activity going on. And within household and cultural factors play a key role when animal source foods are consumed within the households by women. For example, in a household when there are multiple family members, often people who are higher up in the hierarchy decides what a pregnant woman should consume and how much they should consume. And also religious beliefs play a key role. For example, there are periods when a certain type of food will be restricted, mainly due to religious beliefs. And also a certain proportion of the population are vegetarian, so the only animal source food they consume are milk, and they do not consume any other highly nutritious animal source foods such as eggs or meat. There is also a low awareness and some misconceptions about animal source foods, especially regarding the foods that are consumed by pregnant women. The good thing is that there is already some demand side interventions in place in India. For example, there are public sector run nurseries for children aged up to 5 years old, and the government is already distributing eggs through these nurseries so that these kids who attend these nurseries get at least 1 egg per day. There is poor quality assurance systems and infrastructure in place, which is really important for animal source foods because they are highly perishable. And again, seasonality play a key role in regarding the availability of animal source foods. So moving on to the discussion, from the initial insights, it seems like it's more practical to focus on culturally acceptable food, as for some people, especially for vegetarians, focusing on any other animal source food, anything other than milk, it may not work. And because of the perishability of the animal source foods and poor infrastructure, it is sensible to focus and encourage smaller local chains so that there is no need to refrigeration because there is no need to preserve, and the interventions to increase the supply and overall value chain efficiency of this smaller chains seems more feasible. Also, we require tailored interventions based on current availability and consumption practices. For example, certain communities prefer a certain type of animal source food, and hence an intervention that aims on a specific animal source food that is not consumed by the majority may not work. So I would like to thank our funders who are UKRI and GCRF for the project. And I would also like to thank the entire team of the Stuntingham who supported for this work. Thank you.
Thank you very much, Bakia. So that was our last speaker. We'll now take the questions that have come through. Already, I think if you still want to add questions, please do so and add questions to the chat. I will ask the questions that have come through so far, and then I will add some of my own questions as we move along. The first question that has come through is from Gabriela to Priyanka, and she asks, can you expand on the method you used to derive your attributes and attribute levels for the DCE? Did you use focus groups?
Yes, Gabriela, actually we have carried out that literature survey, and also for this study we have steering committee, and there's a technical reviewer from Professor Alishala, and we got their views as well, and also take into consider that the SSB regulation, that is, it is not applicable for that milk-based products. So because of that, we have designed that how to capture this the effect of traffic light labeling, because that it is not already covered that sweetened milk-based products. Take into consider all these factors, we have selected these 3 attributes. And also for this selected these attributes and levels, we got the technical guidance from Professor Ali Shalak. He's the IDRC resource person.
Thank you very much. And then the next question is from Sarah McClung, and she targets her question to Medina. The question, Medina, is, did this study inform any change of plans for the MNAP2 performance monitoring in any way? Over to you.
Thank you, Namukolo, and thank you, Sarah, for your good question. I can say yes, these lessons learned helped us to identify areas as well as the technical working groups that needed to be strengthened, and also the ones that needed to be highlighted so that to come up with smart indicators. Because while we were conducting this study, some of the KRAs were not in a good position to say that some of their objectives were met because they were too ambitious. So this study was like an eye-opener to come up with smart indicators that can allow us monitor progress in MNAP2 implementation. So the study were taken very seriously during the development of the second MNAP.
And an additional question, Medina, that I would like to ask you is, on the African continent, we are always being told how things works better for coordination from the Prime Minister's office, and your study seems to have found the same. I've always wondered, does that mean when we are in the PMO's office for coordination, there is no improvements that we can make, or are we overlooking any improvements because it's working so much better compared to elsewhere?
Thank you, Namukolo, for your question. According to our government setup, it's easier if the sectors are coordinated from that level, because most of them are under the Prime Minister's office. And for nutrition activities, the overall activities are supervised by the Prime Minister's office. So it's easier for it, according to the mandate, to task the sectors to implement whatever is supporting the nutrition activities. And so that's why it was advised by most of the nutrition stakeholders who participated in this study to continue the coordination from the Prime Minister's office.
Okay, and then the other question I have is on the presentation on the traffic light system. I think there was an indication that milk-based products were exempted from the traffic light labeling system. Why would they be exempted? Does it mean if they loaded the yogurt with sugar, it didn't matter? Over to you.
Actually, that in Sri Lanka, that usually consider that milk-based products are highly promoted for school children, and because of that, they are not go with this traffic light labeling regulation for these milk-based products. That's the main reason for that they have that the milk-based products are exempted from this traffic light labeling system.
Okay, thank you very much. And then a question for Gabriela. The issue of the fact that there was some compensation in some locations in terms of the positives that were being gained from the implementation that was made to improve better choices. what was the reason for the compensations that actually took place? Do you know? Over to you.
Yeah, thank you, Namukolo, for that question. Yeah, I think that it will be interesting to complement my findings with a qualitative study to understand why that happened. But we think that this could have happened because the regulation in Chile actually didn't include these other locations. So foods, for example, that were sold in restaurants or foods from informal vendors that is very easy to find, for example, around schools or in different parts of the country. Those were not regulated. So we think that that could be one reason. But another reason also could be that because these children are growing, so we're growing over time during the time of the study, they are also engaging with other food environments. So for example, adolescents are buying more foods on their own, they visit more restaurants or corner stores, so that could be another reason. But yeah, we found this clear partial compensation. I didn't analyze the level of compensation to see if that actually like, yeah, if we lost something, as you mentioned, that was gained in the school environment, for example. But yeah, this is something that needs to be studied. Yeah, the why.
Okay, thank you very much. And then I'd like to field a question to Katerina. In your work, it sounds like public food procurement and multi-stakeholder collaboration structures were shown to be mechanisms that could positively promote the food systems approach for municipalities. Could you perhaps shed a little bit more light on what type of public procurement you are referring to? Over to you.
Thank you very much for the question, Kogo. So the framework that I used identify multiple outcomes and tools that enhance multiple outcomes, and public a tool that enhance multiple outcomes. In this case, we had different examples. For example, the food regime school program that cities buy food from their local producers to serve in schools, for example. And also the public food procurement for school meals in general, in canteens, where some municipalities change the criteria again to buy more local foods to like the DOP or the specific products that have that are considered nutritious foods. So these kinds like school meals, and because municipalities are responsible for school meals, and that were mainly regarding school meals.
Thank you very much. Yeah, Gabriela, to you, I had a look at some of the information that you posted in your abstract online, and I found it very interesting that you indicate that the impact of some of these policies that you presented on could be enhanced with strategies implemented out of school food environments. What type of out of school policies do you envisage that would actually help better food choices for adolescents? Over to you.
Yeah, thank you, Namukolo, for that question. Yeah, I think that when I'm referring to out of school, I'm referring mostly to those policies that regulate, for example, things that are around the schools. So zoning policies, for example, there are some cities in Chile that are implementing those policies, but very little is known about the implementation of those policies. So that's one example, zoning policies, and also like expanding what we mean by school, and not only including what happens inside the school, but also in neighborhoods surrounding school.
Thank you very much. Again, based on information that was put online, now to you, Priyanka, you indicated the willingness of consumers to make trade-offs in terms of between attributes of products. Could you perhaps shed some light on the types of attributes that you found the consumers to be willing to make trade-offs on, and what might be driving those types of decisions?
That is mainly that they are preferred to take trade-offs going for this traffic light labeling, that more healthier options, and also that when compared to that carbonated beverage, they that mostly go for this that sweetened milk-based products. However, that traffic light labeling is not applicable for this traffic milk-based products. So one of our recommendation is to introducing this traffic light labeling system for milk-based products as well, because that when making that their choices, they go for this they use this knowledge on this traffic light labeling. So not having this traffic light labeling in these milk-based products is a that the consumers do not get that required information to make their choices.
Thank you very much. And then I would like to ask a question to Bhagya, and specifically it is with reference to your finding that addressing the supply chain challenges can be done by looking at introducing price governance to improve affordability of animal source foods. Now, it's animal source foods are always flagged as inaccessible because of price. What type of price governance are you referring to that might be explored? Over to you.
Yeah, thank you for the question. So in terms of interventions or specifically looking at price governance, so at the moment for the animal source foods that we are interested in, the prices vary quite a bit depending upon the seasonality and depending upon the type of product, for example, processing. And this doesn't work really well neither for the producers nor for the consumers, especially the consumers that we are targeting. So one thing that would work is some sort of subsidizing the production process a little bit so that it is not difficult for the producers to produce good quality products. And also sort of introducing some sort of pricing system so that it reflects the quality of the product produced, so that the consumers can access the products based on the quality of the product, and at the same time the producers who are producing good quality products are rewarded as well.
Okay, thank you very much. Kamdong, over to you for your question.
Thank you. So I have a question for Gabrielle for your study. So can you, I mean, it's very interesting to see that how both 4 years old and 13 years old compensate their intake of sugar and fat by eating more from the out of school setting. So I think I have a two question. Like, can you elaborate like how this specific policy influenced how this food labeling is implemented differently for school versus for out of school context? And yeah, out of school context. And the second question is how the 4 years old cannot, I don't think in Chile, the 4 out of school can really get food, purchase food for themselves. So is that really about caregiver behavior instead? Because they cannot go out of school and purchase for themselves. So it should be like caregiver and like mothers and caregiver do that for them.
Yeah, thank you so much, Cam, for those two questions. Regarding the first question, one important aspect that I didn't mention in my presentation is that foods that are sold in restaurants or informal vendors, for example, can sell foods that have labels, but those foods cannot be found inside schools. And why we think that we found this increase in these critical nutrients in out-of-school settings is because most of those foods come from restaurants or fast food intake. I didn't present here the analysis by food group, but that will be interesting to like as a follow-up to see where these sugar, fat, and sodium are coming from. But we think that is mostly from fast foods and restaurants or street food, because that's also very common in Chile, like a fried dough or like hot dogs or things like that you can find in street informal vendors. And regarding your second question, in Chile, there are those policies. If the child or adolescent can go outside the school to buy foods, that depends on the city and on the county basically. But they cannot go outside during the day, of course, but they can buy foods at the entrance. For example, there are these informal vendors that have their carts, the little carts in the front of the entrance, basically, and they can buy those foods. So that's one way that they can buy those foods. And the same at the when they go out of the school, when they go home or on their way home, because some of these children live close to the schools. So on their way home, they can find corner stores or these informal vendors where they can find things that they can't find inside schools. For the children cohort, when they were 4 or 5 years old, that couldn't happen. But when they go from kindergarten to the elementary school, that changed. I know that from our study, we know that children that are in first grade, they have money that to buy things in school. So that's something like that is very common in Chile. Like pocket money.
So it sounds like the parents, we are also we also have our issues that we need to address to make sure that our children develop good feeding habits. I think we've come to the end of our presentations. We've really had quite an interesting session. I've definitely enjoyed it. We have been looking at food systems, governance, policy, and legislation, and we've looked at different examples from different places. So I'd like to ask you to help me thank our wonderful speakers, Katerina, Medina, Gabriela, Priyanka, and Bagya. Thank you very much for your interesting presentations. Those of you who haven't looked at the abstracts already online, I really encourage you to go and have a look. There's a lot of lessons to be learned there. Thank you very much. And thank you also for the IT support and our hosts for today. And thank you to everybody. You must have a good rest of the day.
Wonderful. Thank you, Namakulo. And I echo everything you've just said. A huge thank you to all of our wonderful presenters. That was a really interesting session. And also thank you to all participants for your really fantastic questions, and they were all fielded excellently by our presenters.